Happy New Year, everybody. Welcome back to Paging America, where we explore the power, profit, and politics shaping American healthcare and what you can do about it. I'm your host, Miles Baker, along with Dr. Rob Davidson. Dr. Rob, Happy New Year. How are you doing?
Happy New Year, Miles. I'm doing, I guess as okay as anyone can be doing.
Yep.
Probably people listen to this show, a lot going on. Some of it we're going to talk about, and it's been rough. How about you? How's your New Year?
Yeah. My New Year was great. I had a nice break. I got
Yeah.
that new baby, and we made a lot of Italian food at my house,
Good.
and it was nice. And it was nice to not have a rush of news throughout the break. It seemed like there was a little bit of news, but there wasn't a ton of news. And then we really shot out of a cannon as soon as we rounded the corner into Monday. So, with starting with Venezuela. So,
Jesus, yeah,
it was really something. So,
yeah, for sure.
But we have an enormous show today, a very good show. We have a lot of updates. These guys are moving. The administration is moving very quickly, and we have a lot to stay on top of in terms of healthcare. But before we get into the healthcare news, we did want to talk about Minneapolis. And we don't have a lot to add besides our condolences and sympathy for the families and those folks that are involved in the tragedy up in Minnesota. But there was a component part of this in which it looked like ICE agents denied medical care to the victim of the shooting. So we wanted to watch the video of that and get a quick reaction before we get into the straight health news. So if we could toss that video right away.
Go check a pulse.
No! Back up! Now!
I'm a physician.
I don't care.
We understand. We got EMS coming. I get it. Just give us a second.
We have medics on scene. We have our own medics.
Where are they?
Really dark stuff. Yeah. So it was reported. So despite what was said there, it was reported by a number of witnesses that help did not show up for 10 to 15 minutes. That folks weren't treated. And I guess, Rob, everyone in the country is talking about what happened in Minnesota this morning. We're recording on January 8th at 10 a.m. But your reaction, have you seen a situation where a physician or a healthcare provider was sort of denied access to someone in critical condition?
No. I mean, I've personally just had a number of occasions. I can remember when I was a medical student driving on Christmas morning, and there was a horrible accident in the median on a highway kind of between my in-laws and my parents' house as my wife and I were driving. Two medical students, we pulled off and we went to try to give aid. There was a trauma surgeon who showed up, and the people on the scene were very appreciative of that individual sort of lending a hand, like allowing them to be there, just be a part of it, not getting in the way. I mean, I can remember seeing a motorcycle crash right in front of me on a road not far from my house and hopping out of the car with another doc and helping to stabilize the situation and providing genuine care, right, for that person, stabilizing their neck because we don't know what happened before EMS arrived. And boy, in something like this, I mean, what that doctor said, I want to check their pulse, right? We don't know the injuries. If this person had an injury to their airway, maybe they needed someone to stabilize their jaw and could have provided like a critical bridge to EMS arriving and saving their life. I mean, as it turned out, horrifically and tragically, the victim died. And I don't know that there's been any reports of exactly where the gunshot wounds were, but, not knowing that at the exact moment, like that is not within, I don't know the protocols, right, of police, what they're supposed to do, but just like basic humanity. If someone wants to offer help, we should let them get help. The whole thing.
I think it's a pattern. It's a pattern that we're starting to see in with ICE and Border Patrol. We've seen them disrupt emergency departments in Chicago. We've seen them disrupt emergency department. We've heard reports from physicians that we've worked with of them disrupting emergency departments in the city of Detroit. And now you see sort of this. It feels like it's just sort of a pattern of, not dealing with the humanity once, even if you were to believe the line that this person posed imminent danger. And I think we can see with our eyes that probably was not true. But even if you were to believe that, if the danger was over, letting medical help through to administer care to someone who is gravely injured, and the inability to do that, and sort of the the disinterest in doing that, especially the quote, "We don't care."
We don't care.
It's really something. So I think that maybe says it all. So I'm not sure we have much more to add to that. Obviously it's a developing story in Minneapolis. Our hearts go out to those that are personally affected, and then also Minneapolis has been through a lot in the last couple of years. So the whole city.
Absolutely.
Okay, let's dive into the healthcare news. Just some things we're going to cover today. We have developments in the Medicare negotiated rates. We have developments in the insurance markets that we're going to cover. HHS slashing billions of dollars from blue states. And then we have some funny news with the AMA seemingly cooperating with RFK and some of his goofier positions. And so we're going to get into that. And then also the latest on Trump's mental health and physical health. So let's just dive right in, since there's a lot to get to.
Absolutely.
So new Medicare negotiated rates have gone into effect. On January 1st, negotiated lower Medicare costs for 10 prescription drugs went into effect. This is the outcome of Biden's 2022 Inflation Reduction Act, which authorized and required HHS to negotiate the maximum price drug manufacturers can charge Medicare plans for 10 popular drugs each year starting this year, and then more drugs every year thereafter. This is a policy that is negotiated rates are a policy that are spread across the developed world. It has been a big fight for decades and decades and decades in the United States of America. Biden finally pulled it off. And we're starting to see the fruits of that. Obviously, Trump is taking a little credit for it because that is what he does.
Yeah.
But so earlier this year, the Centers for Medicare and Medicaid Services announced its first set of negotiated maximum fair price for 10 selected drugs. Negotiated prices ranging from 38% to 79% below their list prices. So significant reductions in the cost of these very expensive drugs. A drug's list price is the manufacturer's sticker price, though it is rarely what insurers or patients actually pay and is mainly used as a starting point for negotiations. I am not going to list all the drugs because I practiced saying all these drugs 3 or 4 times before we before we recorded it. I couldn't do it. But what I did look up, Rob, is the extremely complicated process by which pharmaceutical companies undergo naming drugs. It's really something if people are interested in it. Take a look. The news on drug prices is not all good, though. Drug makers plan to raise U.S. prices on at least 350 branded medications, as reported by Reuters, including vaccines against COVID, RSV, and shingles, blockbuster cancer treatment, Ibrance, and even as the Trump administration pressures them for cuts. So costs going down for the government, and 10 negotiated drugs. Good. Thank you, IRA, and thank you, Joe Biden. But then costs going up on 350 branded medications all across the board, treating all sorts of different illnesses, and not much seemingly being done to stop that. What are your thoughts, Rob?
Yeah, why can't we just negotiate all the drugs? I don't know. Like, is that a politics thing? You're the politics guy. Is that a politics thing?
No, I mean, it seems like they're headed there with the 10 and 10. If they, as long as there's not meddling, and there already has been meddling, right? There's orphan. They put in an orphan. There was debate around the orphan drug carve out during the big beautiful bill, and we've talked about orphan drug carve outs on this program before, but it's basically a way for drug companies to get exceptions.
Sure.
Sometimes those exceptions maybe are warranted because of R&D, and most of the time they're not.
Yeah,
vast majority of the time
for
they're
sure.
not. So I think so. So I think there's progress being made, but I worry that the Trump administration will interrupt this process.
Yeah, and then what they'll definitely do, right, is extract maximal benefit politically for Donald Trump and for Republicans,
for sure. Of course,
by saying, look what we did with these negotiated prices that had nothing to do with them, that every Republican voted against, right?
Yeah.
The bill that allowed them to negotiate these drug prices back when Biden was president. And then on the other hand, won't do a damn thing about drug companies raising prices on 350 branded drugs, and about drug companies putting up patent thickets so that generic drugs cannot come to market as quickly as they should by law, and keeping the branded drugs being the only option available to doctors and patients. And then those just keep making ridiculous profits like they have been all along. So that's the worry, right? Trump will take a victory lap on the negotiated prices and then not do a damn thing about the other when he had nothing to do with it.
Yeah, that is the worry. The politics of it aren't great because, as we know, for folks who follow this show, is like it is the case that one of the most politically potent and one of the most popular things you can do in the United States of America is lower prescription drug costs.
Right.
In some states, it's 1 in 5 people have trouble affording the medications that physicians have prescribed them, or even more than 1 in 5. But at least in some of the states we've worked in, it's easily 1 in 5 folks are like, they're either splitting pills, or they're foregoing treatment, or they're just not doing it at all. And you can imagine that with healthcare costs going up in the insurance markets, that the pill cutting, or sort of skipping your prescriptions, or metering out your prescriptions in ways that are not prescribed, is potentially going to be even more widespread.
Yeah, and you've said it before, right? The pollsters, Republican pollsters, have told Republicans, quit talking about ACA, don't do anything about it. You're already screwed. You lost on this. Talk about drug prices. And so they're going to talk about drug prices. And this is something they're going to say, look, 10 drugs, less expensive. Donald Trump's president. And, you know, I don't blame people for not spending their precious free time trying to dig into how that policy came to pass. It's just that it's here in 2026, Trump's president. He'll probably get some of the credit for it. And it's kind of bullshit, but it's you know, good for the folks it helps, for sure.
Yeah, it's really something to say with a straight face. Tony Fabrizio, evil GOP pollster, telling the Trump administration, go make your signature campaign message, Joe Biden's accomplishment from 2022.
Well, and saying you've already lost on the ACA, on subsidies, on health insurance. So fuck it, just let it be. Like, you know, screw the 22 million people who are going to be, you know, who are already being harmed by that as of now. Just another little sick moment.
Yeah. All right. Well, next up, so another shoe is about to drop on healthcare costs. Health insurance costs are going through the roof thanks to Republican inaction, but there's another shoe that's about to drop when it comes to healthcare costs, out-of-pocket expenses. Via Wendell Potter at the great Substack Healthcare Uncovered, there's another aspect to America's looming healthcare crisis that almost no one is talking about. It. This is the other side of the coin, the out-of-pocket expenses that everyday consumers pay for doctor visits or prescription drugs because of higher deductibles, or because of the growing number of patients who will risk not having health insurance at all next year because they're no longer afford it. Whenever we're talking about costs, we're almost always talking about insurance premiums, but it's much harder to track the individual patient's out-of-pocket costs. But Wendell, former Cigna executive who's been on the show, he's been tracking some of the out-of-pocket costs, and it looks like those are going up as well. So even if you do have good insurance, your out-of-pocket costs could be going up. And if you have sort of bad insurance or no insurance, your out-of-pocket costs could be skyrocketing.
Yeah, and they're directly connected, right? So when the premiums shot up, when the subsidies went away, for some people, they said, I can't afford anything and I'm done. I don't have insurance. Those folks are paying, you know, full boat, and that's going to screw them. But some people then went from a silver plan to a bronze plan, which maybe has premiums they can afford, but now has a $10,000 deductible or $12,000. So nothing's paid for until they pay $10,000 out of pocket. Or they went to just a catastrophic plan so that if they, you know, need major surgery, they won't go completely bankrupt. But then still, you need an X-ray, you need a CT, you need to get an antibiotic. You got to pay for that out of your pocket. And as those prices go up, that's hitting a whole lot of people. The other piece of this, and I know Wendell's talked about this, is folks on Medicare, right? Last year, 51% of people on Medicare had privatized Medicare, so-called Medicare Advantage, which is private insurance administered Medicare that has much higher out-of-pocket costs. I don't know. That was 23, I think. I don't know, or 24. I don't know what the numbers were for 25, but it's gone up every year. And so I'm sure it's well over 50% still. And that's a group of people. Now, these drug prices coming down, that's great. Okay, cool. But, you know, hospitalization care, routine doctor care, all of that is now being shared by many people who are on Medicare as well. And so I think Wendell's, you know, reporting on this is super important. People should check that out.
Great. Yeah. That's Healthcare Uncovered on Substack if you want to check it out. Here's next up. The Guardian's reporting that Canadian officials say U.S. health institutions no longer dependable for accurate information. That's bleak.
Wow. That's nice.
So Canadian officials say U.S. health institutions are no longer dependable for accurate information, and health officials worry that distrust in healthcare will creep into our northern neighbor. Canadian officials and public health experts are warning that U.S. health and science institutions can no longer be depended upon for accurate information, particularly when it comes to vaccinations, amid fears that misinformation from the Trump administration could further erode Canadians' confidence in healthcare. In December, Canada's health minister, Marjorie Michael, warned that U.S. health and science institutions can no longer be depended upon for accurate information. In an interview with the Canadian press, she said, "I cannot trust them as a reliable partner." No, that's a quote. Michael also told CBC News that some Canadians could be influenced by Kennedy. The minister's comments come at the conclusion of a disastrous year for measles in Canada, as the country was stripped of its measles elimination status, the status that we are probably also going to be stripped of here shortly in the United States in November, with more than 5,000 cases were reported across the country. We have over 2,000 cases reported in 2025. It's a surge that is, I don't think we've seen this many measles in decades.
Yeah.
Yeah. And yeah, that's just troubling that we're getting measles back in Canada and the United States.
Jeez.
The Canadian response is understandable, especially with CMS announcing over the holiday break that it will no longer require states to report their childhood vaccination status. So this is back to COVID. If we don't measure it, it's not a problem. Sort of situation. Do you if people remember?
Stop the testing, right? That was President Trump at the time. Stop the testing.
And that's so spooky. I mean, it's happening with the labor statistics. It's happening. So it's this sort of undermining of our ability to see a problem so we can try to tackle the problem. In their mind, makes the problem go away, or maybe they just don't have to deal with the consequences of not administering the government. Rob, do you remember when that happened in COVID? I found that to be so spooky, and it's so small ball compared to what they're doing here.
I think I remember there was like a cruise ship that they thought there was COVID, and he didn't want the cruise ship to be able to like land and disembark because then we won't have the cases. They just don't exist. Yeah. I mean, a lot of this. And then recently, I think announcing from the CDC that they're revamping the recommended immunizations for kids, right? Rotavirus vaccination, RSV, the biggest hospitalization driver for kids every year in this country. Vaccines against meningitis, they're no longer universally recommending. We talked about the infant Hep B and the fact that there were 20,000 cases of chronic hepatitis previously, down to like a dozen or so because of universal vaccination with Hep B. Like it's understandable, I mean, Canadians, they're like typically so nice, I mean, this doesn't seem very nice of them to do this. But it's totally understandable, but it's coming from within too, right? I think you said in Chicago, where you now have a child, your pediatrician said they're not looking at the CDC schedule. They're looking at the AAP schedule, the American Academy of Pediatrics. They're not trusting the CDC or the federal government either. I think that's just going to be the reality for a little while.
In addition to RFK, just to riff off what you're saying, he has changed the recommended number of childhood vaccines from 17 to 11. He's citing the policies of Denmark, a country unlike the U.S. with universal healthcare coverage. Kennedy said, unironically, the decision protects children, respects families, and rebuilds trust in public health. The CDC that parents could choose to have their children receive some of the previously recommended vaccines, including those for flu, rotavirus, COVID-19, meningitis, hepatitis A and B, after shared clinical decision-making, which I assume is a term they're using for like talking to a doctor.
Yeah.
However, many parents have no idea what shared clinical decision-making even means. I guess that means that it's going to be up to physicians and conversations they have with parents, but it seems to let like sort of parents off the hook to say like, no, it's pretty optional to get Hep A or to get COVID-19 or to get flu and rotavirus, that it seems to create a permission structure. If you're a little skeptical, or if you're not even skeptical, but like worried about vaccines, that it's sort of a you take it or leave it situation coming out of the CDC.
Yeah, I mean, here's where I land, right? Bobby Kennedy for decades and that whole anti-vax movement have created so much of the distrust, right? Then they get into power and they say, well, we're going to make these changes to bring back trust. Well, for people who are really digging in deep to it and are paying attention, the folks who he kind of sort of activated or created with that distrust, yes, they're going to say, well, I trust him, right? They do. They wanted him there. That's that political block of Maha that Donald Trump relied upon. The problem is, for some folks, is that there's a lot of folks out there who aren't fully committed one way or the other. They're living their lives. They're having kids. They don't want their kids to get sick. They don't want other kids to get sick, right? But probably worrying more about their kids, whether they get sick or not. And they might see something on TikTok. They might see something somebody shared on Facebook. And the highest, level of our public health apparatus in this country, and RFK who runs it, is telling them one thing. Now that is where they are basing a lot of that shared decision making. Shared decision making is something we do all the time. We put it in charts as doctors, when we have a conversation like, hey, I want to do this test. Here's the risk. Here's the benefit. That's shared decision making. Patient gets to say, I want to do it. I don't want to do it. We don't say that to the patient. We are now doing shared decision making, right? It's just normal human conversation. So for them to put it in print is weird, right? He's a weird dude. So that makes sense. But right, then people come into their doctor's office and they've gotten this information from somewhere. It came from CDC, came from HHS, and immediately it makes it harder to convince them, hey, it's probably a good idea to protect your kid from RSV so they don't end up in the hospital, or protect them from meningitis when they go off to college. That's the problem. Back to the Denmark piece, like the problem with adopting a vaccine schedule, that parallels objectively one of the best healthcare systems in the world. I mean, any ranking system you see of the OECD countries, US is near bottom, if not bottom, because of health inequity, because of lack of insurance, and Denmark is near the top, right? And so you have a system where 95% of kids are getting vaccinated altogether. So if you delay a few here or there, you've got herd immunity, you're fine. You've got a system where nearly 100% of people have a primary care doctor and access to that doctor without cost, right? So you just have a system that is so different. Nobody, or nearly nobody's slipping through the cracks. You cannot layer that schedule onto the system, or lack thereof, we have in the US. Too many people fall through the cracks, and kids are going to suffer, families are going to suffer, and communities are going to suffer.
Right. Yeah, that makes a ton of sense. Of course. Yeah. I mean, the variability in the health system quality from where I live now in Chicago, from where I grew up in northern Michigan, is extraordinary, right? It's not that people aren't trying hard. It's not that doctors and nurses aren't doing a good job. It's just that the health system is just like, it's got less money. It's got less access to specialization. It's got, it's difficult. And Denmark is small. It's small.
How many million people? I'm not going to quote how many people. I don't want to be inaccurate, but it's
3. Yeah.
And let's not disparage the nice folks of northern Michigan and the UP. Yeah, I do work up there, and I trained up there. It's freaking great. It's just there are really long distances between where you can get a doctor and where you can't, right? And it's just like the ability to see a doctor up there is objectively harder than in the Chicagoland area. It just is.
Yeah, it takes 30 minutes to get to the emergency department. Yeah. And sometimes through a lot of snow. So I don't know. It just seems like, anyway, now we're 6 million. We're getting a real-time fact check. Denmark is 6 million people. Right. Thank you, Chris.
Yeah.
Yep.
So real problem, just saying, well, look, they do it in Denmark. And even Bernie Sanders tells us Denmark is a great system, right? Bernie Sanders always like, well, if you can get universal health care in Denmark, okay, we can't take what they do in Denmark and apply it to here unless we're willing to build a system like they have in Denmark to cover everybody. Let's
do it. Let's build a system to cover everybody.
Absolutely.
We're for it.
All full Denmark.
That's right. All right. So you heard it here first. When Bobby Kennedy comes out for building a Denmark-like universal healthcare system aggressively, we're going to be on. We're on for it.
Absolutely.
Great. All right. Speaking of projects with Bobby Kennedy, we have some I want to say disappointing news out of the American Medical Association cooperating with RFK. Maybe we can throw up the photo from the internet. This week, American Medical Association President Bobby McCamala posted that he is, quote, excited about the AMA working with HHS to improve the health of our country by focusing on what we eat. There are aspects of healthcare that we differ on, he said, but there are many things we can work on together. Sounds reasonable. Sounds like a reasonable thing to say. But the statement was made in response to the release of new dietary guidelines issued by RFK that puts increased red meat, whole milk, and cheese at the top of the food pyramid in an effort to end the war on saturated fats. At the same time, got rid of the recommendation on limits for alcohol use. In the Dr. Oz said, he wouldn't recommend that people drink alcohol, but that it was a social lubricant, and that they were basically lifting the 1 drink per day for women, 2 drink per day for men cap, their recommendation. So working with RFK on anything at a time when he's compromising public health in so many ways seems like a lot of is a non-starter for a lot of the doctors we work with and talk to. I think I think what's really troubling about it, and it's particularly with the photo op where Bobby Kennedy looks like he's addressing the president of the AMA and sort of, I don't know if he's giving a lecture, but the president of the AMA is smiling while chatting with Bobby and then posting about it. That I think what the thing that's really troubling about it is so much of this is abnormal, including the thing that they're there to announce, which is the new food pyramid, which is, the written part was more in line with dietary guidelines of yore, but the graphics and the things that they put out were like with cheese at the very top. Please eat more cheese. It seemed like to indicate.
You just lost Wisconsin for the podcast. Sorry.
Sorry, Wisconsin.
Shit.
Sorry. I think even Wisconsin would agree that cheese curds cooked in beef tallow shouldn't be at the top of the food pyramid.
No, you can put it in there on the side. Oh my god.
Right. That it's just really disappointing that what it does is it seems to like pretend like the context of what's happening isn't happening, which is this aggressive destruction of the CDC, the pulling of science research across the country, and the sort of joyful and gleeful destruction of Medicaid and the raising of healthcare costs on over 20 million people across the country. Like all of that is happening at the same time, but we're doing a photo op over the food pyramid. So anyway, what's your take, Rob? You're a doctor. I'm not.
Yeah. I mean, so it used to be the recommendation was, or not recommendation, but sort of the allowances. Okay, 2 drinks for men, 1 drink for women. That is heart healthy, supposedly, right? It was thought to be, and thought to be something you can say, hey, yeah, we can so you say that's okay. There's evidence coming out in the last few years, like without a doubt, that any amount of alcohol isn't a good thing for you.
Sure.
Right. I'm not a prude here. I'll drink a beer on the podcast to prove it if you have to. Like, I'll have a glass of wine, a glass of beer. That's great. People can do that. That's fine. But for like Dr. Oz and Bobby Kennedy to go out there, for them to lift that number directly in opposition to what like the objective data shows us makes no sense. And then this idea, let's decrease saturated fats, but then let's promote consuming things that provide vast majority of saturated fats, full fat milk, no more nutrients than fat free or lower fat milk, just a lot more fat. Saturated fats, right? Beef, it doesn't make sense. And then for the AMA president to sort of embrace this and I guess endorse this when they say, what people eat, like we're in line with that. I don't know what this says about the AMA, but the AMA is not like, I don't know. They claim to be the voice for doctors. They're not the voice for me and a lot of the doctors I talk to, right?
Yeah.
And they've borne this out with how they've engaged with politics. I don't know if you have some information on that.
I have some stats on this because I think when we think about, I was just I was very troubled by that photo, if I'm being honest. I thought just like we need
what are we doing?
We need to physicians need to stick up for themselves. Yeah. It's sort of my thought on that is that the AMA has the AMA has $1 billion with a B dollars in the bank. It shouldn't be able to get bullied into silly things. What I think the AMA's problem is here is that there has been an extraordinary shift in the way doctors participate in civics, and that is less because it is partly because doctors have changed. There are more women doctors than there are men doctors. There are more employee physicians than there are physicians who own their own practice. But it is also in part because of the position of the parties, where you have to get sort of wild healthcare claims out of the Republican Party, and you get sort of orthodox changes or incremental changes to improve healthcare or radical changes to improve healthcare. But it's all sort of in the realm of, it's all in the ledger of like trying to finish the social safety net in the United States of America, while the Republicans are talking about everything from beef tallow to slashing healthcare costs. A few facts about the AMA that I think are important. So the AMA has been giving large donations to Republican PACs in recent years, even while the Republicans have started to take these more extreme MAGA and MAHA positions on healthcare. So, for example, in 2025, so just last year, they gave $5,000 to Bill Cassidy's leadership PAC right after he voted to confirm RFK. Bill Cassidy, votes to confirm RFK. AMA hands him a $5,000 PAC check. Other examples of AMA donations in 2025 include $5,000 to Speaker Mike Johnson's leadership PAC 1 month after the passage of the big, beautiful bill that gutted Medicaid. Like, what is that donation? Across the board, like whether it was providers or industry or pretty much everyone was against the Medicaid cuts because it was such a disaster. It'd be such a disaster for patients and for the markets. And the AMA walks over a $1,000 check to Speaker Mike Johnson. $5,000 to defend our conservative Senate PAC. That's Roger Marshall's leadership PAC. $5,000 to Heartland Values PAC. That's John Thune's leadership PAC. And the leadership PAC hands out that money in one case, and I believe in Elise Stefanik's case, they handed that money right over to Trump's PAC. And so when they give the cash to these leadership PACs, that money then goes directly into coffers of some of the marginal races. The other thing is that the AMA has been handing out money to marginal races. So it's not like the AMA's PAC checks are going to safe Republicans who otherwise will win or will lose. They're handing out PAC checks to people who are going to be determinative of who controls Congress, while the Republican Party makes massive cuts to healthcare and undermines public health and science across the board. Anyway, what are your thoughts, Rob?
I think a couple of things. One, the AMA clearly, and other trade groups, the vast majority of their advocacy has been on behalf of not cutting Medicare reimbursement rates and elevating the paychecks of doctors. Like, I don't think that's a good place for physician advocacy to be. We do okay. Our patients are fucking suffering. Let's advocate on behalf of our patients, right? We'll still be okay. The other thing, I think they're operating under a system that maybe used to exist. They are buying access, right? They think we give over a $5,000 check. This is probably true. We can get a meeting with the staff of that senator or that member of Congress and plead our case on the issues we care about, namely, in their case, the Medicare reimbursement rate cuts and doctors' paychecks. The problem is it has become increasingly clear that access doesn't buy influence, right? Maybe it never did. Maybe it never did. Maybe it did. Probably at some point when there was a normal Republican Party, it did to some extent. And they could sprinkle it on both sides and they could justify it by saying, hey, we just want to be in the room and have meetings with all these people because we want to get the best policies forward in a bipartisan way. Great. They're giving money directly after actions that directly harm patients and harm doctors, right? A lot of the docs we work with at the Committee to Protect Healthcare, a lot of the docs I talk to every day, docs I work with clinically, like them seeing their patients suffering is objectively making their jobs worse, their lives worse, because it's like that moral harm, moral injury to docs when you see someone suffering because they can't afford a drug or they can't get the test you think they need or the procedure or what have you. AMA is saying, well, if we give the money, we can still get in the room. What does it matter if you're in the room if being in the room doesn't do a damn thing to promote like good policies? I think they're stuck in a model with their $1 billion that they don't know their way out of. Yeah. And it's doing harm. It's doing harm. It's keeping folks like Mike Johnson in power.
Yeah, I think it does. I think it does real harm. I think people really do have to call for the stopping of this practice, whether it's at the AMA or whether it's at some of the specialized sort of trade associations of the different physician specialties. That I suspect that a lot of physicians who give money to these things do not know that they are funding both sides of a war. Right. That they're basically like walking money in and saying like, we're rewarding people who are causing us active harm in the hope that a thesis that was true in 1997 is still a little true, that they're not going to just like turn around and like screw us over again, which I think we haven't seen any evidence that that's the case. Right. Yeah. I mean, we've some positive developments in the discussions around possibly striking a deal on the ACA, but that's not because the PAC checks are getting handed out. That's because of the extraordinary political costs for the Republicans. Yeah. It just strikes me that it's either in the most generous interpretation of what they're doing, it's a little old school and the strategy is outdated. And what I think is the more realistic assessment is that it's causing active harm. It's causing active harm to the very people who pay for the PAC.
Yeah.
And
I mean,
their
I will,
patients.
full disclosure, I was a member of the AMA for 3 or 4 years, somewhere
Yeah.
15 years ago, 10, 12 years ago. And
Yeah.
it was mostly because I could get disability insurance. It was a better price, blah, blah, blah. And I didn't know. I wasn't paying attention to who they gave money, how that all worked. And I wasn't giving even money to the PAC, but because it really comes out of the AMA PAC, right? The AMPAC.
Yep.
But then someone shared with me, or I found, or I looked for sort of this practice and where they give their money. And it was around the time of the ACA. And I recognized, like, wait a minute, these guys are like actually doing harm, right? This is back, this is before MAGA, before Trump. They're doing harm. And I stopped right away. I said, well, screw it. I'll pay a little more for disability insurance. It's not worth it.
Yeah.
I hope more doctors kind of open their eyes to that. I hope us talking about it helps some folks kind of see, if not just abandoning the AMA, then going there, getting on those boards, voting, and changing the practice, right? Doctors run this thing.
I wonder if it's even harder than that. Cause I mean, if you're to remember, like Bobby was not Bobby Kennedy, the other Bobby.
Yeah.
He was a good Democrat in Michigan. And like, I just wonder if like the institutional pressures inside of something so old as the American Medical Association and with so much money causes people to change their behavior in ways where now all of a sudden you're accidentally having a photo op with Bobby Kennedy Jr. as the president of the AMA while he destroys the CDC. I just think it's
not good.
Preposterous. Not good. It's not good. All right, we're moving on. HHS slashing billions of dollars from blue state welfare programs that mostly benefit children is the other item of the news. Had to get this bleaker and bleaker. The Trump administration via HHS is slashing billions of dollars from welfare programs, mostly that benefit children, exclusively in blue states. So this is sort of this punitive action against blue states only, not president of the United States, president of sort of mega states and not of the blue states. It's a response to the welfare fraud case in Minnesota. It's a stated response to the welfare fraud case in Minnesota. What it is they're using the welfare fraud case in Minnesota to justify further retribution against blue states that they wanted to do regardless of what's happening in Minnesota. They were just waiting for an excuse. The funds are being withheld from the Child Care and Development Fund, the Social Service Block Grant, and the Temporary Assistance for Needy Families Program, TANF, TANF, often called TANF. HuffPost reports that it's unclear what led the administration to clamp down on TANF in a handful of blue states since the program was not implicated in Minnesota's child nutrition fraud.
Of course.
It's just, we don't learn this. We don't learn this lesson well enough. Like sometimes you'll hear, as the human brain deals with lies poorly. So like when the administration justifies this retraction of funds from blue states, they cite Minnesota. And you think, oh, maybe it's about Minnesota. It has absolutely nothing to do with Minnesota. There's no reason why it's connected to Minnesota. It's just revocation of funds from blue states as political retribution.
Yeah.
Yeah.
I mean, let's call it out, right? If fraud happens, we should expose the fraud. The people who are committing the fraud should be prosecuted, right? We're against fraud. Absolutely.
Yeah.
That's not what they're
It
doing.
goes worse
here.
when there's fraud. There should be no fraud.
That's just not
Pigeon
what they're
Rick
doing
Scott.
here. Yeah. Oh, yeah. That's rich, right? So we should be against fraud. We are against fraud. It's just like with the Epstein files. Everyone say, oh, you don't want to see all the Democrats. Like, yeah, we do. Put them out there. If the statute of limitations hasn't passed, throw them in jail. I don't give a shit.
Yeah,
Democrat, everybody. Like, we're against
even if
pedophilia.
I don't think there is a statute of limitation on some of those crimes.
No.
Throw them in jail.
Yes, absolutely. So I think we just got to keep saying that, right? Collectively, as a group of people who supports like social programs, particularly feeding kids and helping kids and giving kids healthcare. Yeah. Cool.
Okay. On Trump inner circle gossip, and I know that this is sort of my bailiwick, Rob. I know this is not your favorite when we cover Trump inner circle Kremlinology or court watching, but I have to do it. We got to do it. They're the people making the decisions. We hate it. We hate it, but they are the people making the decisions. Katie Miller.
To date myself, this is the Jerry Springer portion of the program.
Yeah, but those folks weren't making decisions for the entire United States of America. So Katie Miller, the wife of White House ghoul Stephen Miller, has gone full anti-vax. Katie Miller discussed her family's vaccination status on the latest episode of her podcast, revealing that her youngest son with White House Deputy Chief of Staff Stephen Miller is not vaccinated and claiming that he could put dirt in his mouth and never get sick. Kind of alluding to the fact that might be because he's not vaccinated, that he's the healthiest. I'm paraphrasing here, but he's the healthiest of the children. And this is while she was interviewing longtime vaccine skeptic, Jenny McCarthy,
Oh, yeah.
former model.
You don't have to say vaccine skeptic. You're being too generous.
Sorry, anti-vax activist,
Yeah.
Jenny McCarthy.
Yeah.
Famously an anti-vax activist. Miller, a former deputy press secretary to President Donald Trump and proponent of the Make America Healthy Again movement, spearheaded by Robert Kennedy, went on to divulge some personal information. I haven't talked about this, but my oldest child is fully vaccinated. My youngest child is not vaccinated at all. My oldest child had milk soy protein allergy, right? And we had struggles breastfeeding. My third child was fully breastfed until age 1, presumably linking all of those things to their vaccine status or sort of alluding to that. She continued, he is my healthiest child and who never, ever gets sick. He's never been on antibiotics. He is like every day I could put like dirt in his mouth and he will not get ill.
Can we just share something? I think if doctors are listening, they know this, and most people probably know this. You don't get measles from dirt, right? You get measles from somebody else with measles, right? You don't get COVID from dirt. You don't get flu from dirt. I can go put dirt in my mouth, vaccinated or unvaccinated, probably not going to get sick. It's just going to taste like dirt. Like, Jesus.
What do you get from dirt?
Nothing.
Do you get anything from dirt?
No. Kids got to eat a little dirt. You have a kid now. You got to know that.
Yeah.
Little boy,
Yeah.
Dude,
Yeah,
got to eat a little
gross.
dirt in life.
Yeah,
you gotta eat a
it's gonna
little.
be gross.
This is part
Yeah.
of the world. God,
That
I know you
is-
like
it's
this.
so-
Yeah,
I just, not a scientist.
yeah.
I, as a non-scientist, I can't believe we are relitigating germ theory. It seems like we're relitigating germ theory here in the year of our Lord 2026, and
Wow.
and it seems, it's so old school. It's just wild. So
Yeah, it's really sad that she would use her kids as political props to kind of try to justify
for
a
sure.
position that is indefensible, right? To defend that position, it's indefensible to be in a position of public trust and to keep promoting this anti-vax view. And then, with the full-throated support of the administration, cutting back their vaccine schedule.
Yeah.
People listening are going to make decisions based on that, unfortunately. And some of their kids are going to suffer. It's really sad.
Jenny McCarthy has been doing this for a really long time. What on earth?
I believe hers started with MMR, right? I think she had a kid diagnosed with autism way back, right? I don't know, decades ago.
And it's just,
And again, like I have to just say, and I don't blame the parents. And I feel really badly for parents if their kid is diagnosed with autism, if their kid struggles, because they're looking for answers. So they do. They're looking for answers. They're looking for reasons. Why did this happen? And we don't know why, right? We know it's multifactorial, environmental, and maybe something genetic and something in utero, or who knows, but we just don't have the answers. And someone like Jenny McCarthy comes along, or Katie Miller, or Bobby Kennedy, and tells them this is the answer. And they say, son of a bitch, these people have been lying to me. They self-flagellate. I screwed up. I did this. Like all of that happens in one moment. And again, that's why I don't blame just the parent. I blame Jenny McCarthy out there just pushing this shit, and Katie Miller. But like the parents that I see of the kid who's got a fever and they didn't vaccinate their kid, and I say, like they didn't have an agenda. They were just trying to do what's right for their kid. They're just getting their information from the wrong places. That's where I think it's sad. I think these guys, Katie Miller talking about it, Jenny McCarthy, that's just absolute bullshit, and they're hurting people, and they probably know it. At this point, they probably know it.
Yeah, I bet they know it.
Yeah.
They're making money. All right, what last topic before we wrap, Rob. So what's up with Trump's mental and physical health? I mean, it doesn't seem good. It seems bad. Trump's health is back in the news with the revelation by the Wall Street Journal that he takes a higher than recommended dose of aspirin every single day. I don't want thick blood pouring through my heart, Trump told the Wall Street Journal. I want nice, thin blood pouring through my heart. He blamed the high dose for the visible bruises on his hands that have been seen in recent months that he's been covering up with makeup. Trump also received a CT scan when he visited Walter Reed Medical Center in October for a secondary physical. According to him, the results were perfect. Concerns about Trump's health, from a droopy face to falling asleep during cabinet meetings, has gotten so intense that there's now a Wikipedia page titled Age and Health Concerns about Donald Trump.
My God.
it's a
crack research
category
department here at Page America found that. Oh my God.
Yeah. But yeah, I mean, the coverage has been wall to wall in some cases. It doesn't matter. Almost everyone's covered Trump's health. What's up with, hey, I'm not a cardiologist, Rob. What's
Right.
up with the thick blood, thin blood
Thick
pouring
blood,
through his
thin
heart?
blood.
That's not it. That's not a real thing, right?
Well, it's so troubling, right? Because a baby aspirin, we shouldn't even call it a baby aspirin. You should not be giving aspirin to babies, but 81 milligrams of aspirin has objectively in people at risk, and in some people just because of their age, shown to decrease the risk of heart attacks and strokes.
Yep.
And maybe some cancers, right? That's great, right? Too much of that becomes a problem, right? I mean, you can overdose on too much water, right? You get water toxicity.
Sure.
I mean,
You can overdose on aspirin,
Jesus, and so that's not an overdose dose, 325, a full dose aspirin. But what it does is it gets you no added benefit, and it increases your risk of bleeding. And he's shown this. I mean, he said in those, I think the same article or a different article, he carries makeup around to cover up his hands because when he gets whacked in the hand, he bruises easily because of all the thin blood he's got flowing around. And so it's really troubling that again, just like in the old days of COVID and bringing in sunlight and bringing in bleach, and now there are going to be some people who see this and are like, well, yeah, why am I just taking this one baby aspirin? That doesn't seem right. I'm going to take more of that stuff. You get bleeding.
He has so much troubling, like, kooky thoughts on his own personal health. Have you ever read about how he thinks you only have like a certain amount of steps in any given day?
Heartbeats too, right?
Any given
Heartbeats
life?
and steps.
Yeah. That you have like an amount of energy that you can expend over the course of your life, and so he tries to like preserve it.
Doesn't want to waste it on exercise. That's what he said, right? Yeah, I don't want to waste it. Yeah, so it's a problem, right? If everyone starts taking a full dose aspirin every day, a lot of people are going to get, bleeding ulcers. That thin blood's going to come out other places. So don't take medical advice from the president. One other thing, and I don't know that we have the clip, but another thing that happened in the press conference where they're announcing the new food pyramid is Bobby Kennedy's phone went off and his ringtone was quacking. And it just seemed like the most on-the-nose ringtone of any person I've ever seen.
I almost think he did it on purpose.
You think?
I almost think he did it on purpose,
us?
Right? Yeah, that he got us, right? That he's like, I know I'm using HHS as my personal political coalition building entity. Enjoy my quacking phone. We'll see. All right, Rob. Well, there's a lot to get through today, so thank you so much for having this conversation. One last question before we go. Any predictions? Well, I think we should do a prediction for 2026, and we can revisit it at the end of the year. Any predictions for 2026 in the world of health?
Predictions in the world of health. I think it's going to be a little dark, right? We're going to see more measles. I think that is unequivocally going to be true, right? We're going to see more measles. I think we're going to see a few more Republicans getting a little bit more of a spine about Bobby Kennedy and about the bullshit that he's pushing. I think as more and more of them get closer to their reelection time, and I think I'm here for it. That's good. That's good healthcare, right? It's all politics, and we got to call them out when it is. But I think you're going to see a little bit more of that as this administration gets closer and closer to lame duck territory and proving that they're absolutely fallible to Republicans, and they're not they're not all Teflon like Teflon Don. I think you're going to have more people pushing back against this. I think you're going to see Senator Bill Cassidy maybe getting a little more of a spine rather than just the random tweet here and there. So here's hoping. I'm hoping.
Here's hoping.
That's hopeful. How about you? Predictions?
I think I got on the negative side. I think you are going to see more, at least attempts at more collusion and profiteering between Trump and the Trump inner circle and the healthcare industry, whether that's pharmaceuticals or whether that's, insurance. I think you're going to see them trying to get a piece of that pie because that's a big pie. And they seem to be insatiable. So we'll see if that happens. I mean, obviously, the totally throwing in with the oil industry is really on the nose. So I think healthcare is next. On the positive side, I think you'll see Democrats starting to grow a spine, and out of this on pushing back on industry, whether it's a pharmaceutical industry or the insurance industry, or big hospital systems. And the reason why I think you'll see that is they're going to start to have campaign rationales when they're campaigning on healthcare. Healthcare is going to be the big conversation. And what you're going to have Democrats, for better or worse, are inclined to start having very specific policy proposals, for better or worse, probably for worse in terms of some of their politics. But I think what you're going to start to see is that the Democrats will have specific policy proposals, and that will inevitably walk them down the road of having a sharper edge towards the abuses we've seen out of the pharmaceutical industry and out of the healthcare industry. And I don't know exactly what policy form that'll take, but I think you'll start to see people experimenting with new solutions for old healthcare problems this year. And I'm hopeful that'll lead to some good.
See, that's a good one because you thought about it, and I think you're spot on. I think if they're truly going to be the party of people and affordability, and they're talking about healthcare, you can't just advocate for cheaper health insurance. You got to go after those big baddies, the big three, big pharma, big hospitals, big insurance that are making big profits. And here's hoping that becomes the dominant theme of what's coming out of that side.
Yep. All right. Okay, I think we're on time. Rob, I'm going to read us out. Today's episode was written by Chris Savage, Dr. Rob Davidson, and me, Miles Baker. It was produced by Amelia Dillon Schneider, Joel Bryson, and Chris Savage. It was edited by Darian Badigan. If you enjoyed today's show, please subscribe and leave us a rating on Spotify, Apple Podcasts, or wherever you listen. Your support helps others discover the podcast. You can also follow us at Paging America on Substack. If you become a paid subscriber on Substack, you help make sure that we are able to do all the things that we need to do to get this show out the door every Thursday. Physicians, your voice matters. Join the fight for better American healthcare by becoming a member of the Committee to Protect Healthcare. Visit www.committeetoprotect.org to learn more. And Dr. Rob Davidson, I'm looking forward to another year doing this podcast with you. I'll see you next time.
All right. See you next time.